In this section, I will talk about the fluctuations of mobility that are characteristics of Parkinson's disease. Optimum medication management involves the right amount of medication to control symptoms, administered at correct intervals throughout the day, so that symptoms do not return between doses. If, however, symptoms do return, this is called wearing off. When medication wears off, there can be rapid changes in a person's mobility. In dose failure, medications fail to kick in, and this is a complication of long-term drug therapy. Dyskinesias are free-flowing, involuntary movements and are also a complication of long-term levodopa usage. They result from too much levodopa in the brain to manage symptoms. They can be prolonged and exhausting, and patients may even injure themselves. A sudden off is when someone has been functioning and then all of a sudden they are not functioning. Off periods are a common cause of anxiety, and this can be a vicious cycle because anxiety prolongs the length of the off time. Speed of change with wearing off and sudden off can lead healthcare professionals to be judgmental, believing the person is acting out. It's important to recognize an off period as a mobility fluctuation related to the disease and to help the person remain calm and rest. Freezing and gait hesitation are forms of gait disturbance that involve short periods of no movement. People may have difficulty initiating movement. Their feet may be suddenly stuck to the ground, so they are unable to move forward, backwards, or to turn. Festination is an involuntary quickening of gait. The person may get going and find it difficult to stop. Medication adjustments may not improve gait disturbance or have only limited improvement, and physiotherapy consultation is recommended. Various cues can be used to break a freeze. If someone freezes when walking, auditory cues, such as coming up beside them and counting slowly, can help. Visual cues, such as a laser beam, or a visual and auditory cue, telling the person to step over your foot put out in front of them, can break a freeze. If freezing occurs in a doorway, it can help to give the person a visual focus beyond the door, such as a picture on a wall. If freezing occurs when approaching a chair, it can help to tape an X on the floor in front of the center of the chair as a target. Proprioceptive cues, such as asking the person to shift their weight from side to side, or to stand tall and wait for a few seconds, can help. Some people respond better to some cues than others, so be persistent and try different cues. It's important to know that freezing can happen if a room is cluttered, so reducing clutter will improve the person with Parkinson's visual spatial perception and reduce the possibility for clutter-triggered freezing. For resources on cueing, contact Parkinson's Society, British Columbia. Festination is a form of gait disturbance characterized by highly increased stepping frequencies and ineffective and very small step amplitudes without coming to a halt, so the person takes fast, short steps with their weight on their forefoot. This is a risk factor for falls, and it's helpful to tell the person to emphasize leading with their heel, which lengthens their stride. There are many fall risk factors, and falls are a leading cause of hospitalization and death in the elderly, so it's very important to pay attention to fall risk factors. With postural instability, balance adjustments no longer happen automatically and require conscious effort. Problems with balance are not generally improved by medication and are often worsened by some drugs used to treat Parkinson's that lower blood pressure. Falls often occur when someone is dual tasking, backing up, or turning, as more balance and control are needed. And if balance is an issue, we recommend referrals are made for physiotherapy and occupational therapy safety assessments and recommendations of assistive devices and environmental adaptations. Strength and balance are the most important factors to prevent falls, but promoting daily activity and exercise are also important. Research suggests that there are appropriate levels of intensity and duration for an individual, and that the appropriate level of exercise may be neuroprotective. It's important that people with Parkinson's exercise in whatever capacity they can, although exercise programs do need supervision, progression, and feedback to be most successful. Contact PSBC for resources on exercise for your patients with Parkinson's disease. The goal of physiotherapy and occupational therapy is to maintain independence, function, and mobility, and to encourage clients to exercise and have hobbies that improve their quality of life. Physiotherapists and occupational therapists can recommend adaptations and assistive devices to help with activities of daily living as and when they're needed. It's optimal to involve physiotherapists and occupational therapists early in an individual's disease process to complement medication management. That brings us to the end of this section on mobility fluctuations in people with Parkinson's. Thanks for watching. This presentation has been developed by Parkinson's Society British Columbia, and should you like further information, please feel free to contact us. If you are watching this presentation in order, the next segment will cover issues in late-stage Parkinson's disease.